Next speaker is Alexander Msimugo, and he'll be speaking on SADC food access and stability, so focusing more on the southern region of Africa. And just to give you a little bit more perspective on who he is as a person, Mr. Alexander Chido Msimugo is a finance and business analyst. He's also the co-founder and president of Academic Stand Against Poverty East and South Africa. Alexander has worked as a planner in the office of the vice president in Zambia. He's also a certified food and security analyst in the office of the vice president as well, and has been involved in national vulnerability and needs assessment for food security, as well as regional food security analysis. Alexander continues. Sorry, if we can just mute ourselves, thank you. Alexander continues to find new ways in developing and implementing African Development Bank projects for risk insurance, climate finance, and disaster management. Alexander, your time. Thank you.
Thank you so much, Ziki. Okay. Okay, great. So I will be discussing on the subject of food access. As you know, food, so one of the important factors that affect, food security is access, which of course deals with how it sort of discusses how people's ability to access or people's inability to access food. And in that, of course, there are a number of factors that affect food access. So we discuss issues surrounding, the economic factors that might affect people's ability to afford to access food. We discuss issues such as, the social cash transfers of any other issues of prices as well, economic conditions that might exist that sort of affect access to food. So most of this data that we're presenting is based off on IPC reports. So IPC is simply integrated food security phase classification system or method. So most of the data is based off from primary data as well as secondary data, which has been converged through by a number of stakeholders in the region. So very quickly, I will delve into the regional food security overview, what the food security situation looks like in the continent. So currently, we note that the IPC report for 2022 indicates that we have about 55.7 million people that are estimated to be food insecure in the region from about 1st April to 31st March next year. So as this, of course, just shows us the gravity in terms of what the food security or insecurity situation looks like. And most of these factors, as are attributed to a number of severe shocks, which have already been discussed by a number of panelists. I would delve slightly a bit deeper in some of those contributing factors or hazards. So now, in looking at this, I wanted just to show a small snap, also to just look at how the food, IPC nutrition security looks like. So about 18.6 million children under 5 are estimated to be stunted. So this represents about 1 in every 3 children in the region under the age of 5 are stunted. So this just gives you a picture in terms of how big the situation is. And if you look at the progress that a number of countries are making in order against the World Health Assembly targets, you notice that although they're, of course, the picture is quite discernible across different countries. We see that regionally a number of countries have not met up with the targets as soon as as far as stunting is concerned. So now, when you look at the food availability again, in relation to access to food, you note that there has been sort of an increase in terms of production across the region for about 7.5%. Again, this is attributed to, of course, we had a very difficult rain season late onset of rains. Of course, the rains slightly improved at the end of the season, but for most countries, which of course saw the sort of the increase in the agriculture sort of food production. So I wanted to just very quickly, just speak to some of the hazards that have sort of caused, that have sort of affected this food insecurity in the region. And you note that, for example, Africa, like many countries, was highly affected by COVID. Of course, the lockdowns and the IPC reported about 3% of GDP, was wiped out from, the region as a result of the COVID lockdown that reduced economic activity. And of course, we saw climate change and, climatic events and variability, which saw a number of cyclones in different countries that, highly affected the food, the access to food, and specifically even for the vulnerable, populations within the region. And these factors, if you're looking at it from Zambia perspective, you will see that there has been an increase in terms of vulnerability levels, attributing to poverty, inequality, and unemployment in Zambia. This according to CSSO records. So we see that this increased vulnerability sort of affected or sort of actually increased this the level of food insecurity in the region. So one of the key things as soon as access is contained is prices for major staple foods in the region have remained really high. And we can attribute this to one key thing is the ongoing conflict in Ukraine, which disrupted a number of trade systems. We had, for example, in the DRC, prices of major import foodstuffs, so including rice and vegetable increased from about between 10 and 30%, in April 2022. And we saw this picture across many countries within the region as a result of the slowing down of the global economy, as well as the conflict in the Ukraine. And we see that this, is likely to continue. And also we see, for example, in a lot of countries, this has also, we're talking about this disruption of supply chain has also caused an increase in number of the prices of, farming inputs, which has, highly affected people's ability to access foods. And this is very evident in a lot of countries, as we see, for example, in Zambia, as well as Malawi and other countries. So I think this is, generally what we see, and we see the rise in fuel prices and the slowdown in the global. As I mentioned, speaking to this has highly affected people's ability to access food within the region. Now, when you talk about the availability of food, again, in terms of the availability of food in the region, you see, for example, that the maize production, for example, which is Zambia's main staple, you see a reduction in terms of production. This is attributed to the climatic events and in this season. So we see the huge risk in terms of access to food within the period. And as you know, the IPC looks at it's sort of a snapshot. So we see that between the 8 months between now and January, that there will be high food insecurity within the region, and people's ability to access food with this. We see a lot of Zambia already has got about 1.9 million people that are projected to be that are going to project to be in crisis between now and March next year. So speaking to the aspect of food access, I will speak to Zambia's food expenditure share. As you will see, that 10.4% of the population, of the assessed population, spend their income on food. So then we see that people's economic vulnerability has increased, and most of it also what we are seeing is that there's also an increase in urban vulnerability, and this is attributed, of course, to issues around prices and economic unemployment and these other issues. So this has definitely affected people's access to food. Now, I wanted to speak to this very briefly because Zambia, for example, now is implementing a social cash transfer program, which is projected to cover about 1 million people. And as I mentioned to you, that this food secure population now is projected to be about 2 million. So it's still, I think there's still a lot of conversation to be had. First of all, in terms of how effective these social cash transfers are, and whether people are moving into we are providing the cushion that people deserve. But already we see a gap in terms of the affected population and what government is able to do. So I think there is need for more effort and also support to to be able to support these populations. So I'll just give you a sort of a pictorial view again, looking at Zambia's situation in terms of what you see are areas where people are under stress, and have been classified in IPC level 3. So Zambia's innovations, as I mentioned, is number one. Zambia is implementing a $5.3 million cancer risk-based financing program targeted at 1.9 population that is under risk. Food insecurity. Zambia is distributing relief items to mitigate against hunger in those areas which I have discussed about. In general, on a more SADC level, what we are advocating, probably recommending, is that agency, yes, there should be an agency system for food and nutrition for the insecure population, and there also be need, to monitor and to respond to pests. As we know, for example, we had locust problems within the region that affected a number of areas. We're also, advocating for, recommend and expand, high impact nutrition intervention that affect, that target children, as we know that, the high stunting levels in the region, as well as improve women and girls' access to nutrition, just food, education, as it were. Also, again, it's a recommendation that we have intervention programs include a rigorous impact evaluation framework. I think there's been a lot of, government has been, most governments in the region, some governments in the region have been, concerned about whether these intervention programs are making the impact they are supposed to be making. So I think there needs to be a way to design these programs in a way that we're able to see the impact that they're making. Otherwise, we'd just probably be spending money in things that are not necessarily effective, actually impacting people's lives positively. So, again, we are recommending and encourage crop and dietary diversity through growing consumption, diversified diets, including indigenous foods. Of course, there are a number of regions that have been affected by cyclones, Madagascar, Malawi, where thousands of people were affected. We're recommending, to raise funds to rehabilitate and reconstruct flood and cyclone damaged infrastructure, keep open trade priorities for as well as develop resilience building initiatives. Okay, so I think I was just trying to make sure within the 10 minutes, but generally I think that's what we see, and that's what we're recommending in terms of what the food access situation looks like in the region. Thank you.
Thank you so much, Alexander.